Hello, everyone. Welcome to my channel. My name is Chuan. I'm an APCP resident at Mayo Clinic. Today, I'd like to discuss the interview question, what is your weakness? So I always ask myself, the first question is, why do interviewers want to ask this question? I think there are at least three reasons the interviewers want to ask our weakness. The first is to assess our self-awareness. I think the interviewers, by asking this question, can assess our ability to recognize and acknowledge our weakness. And that could show that we have a thorough introspection of our, not only the strengths we have, but also the areas that we can improve. I think it's a sign of maturity. The second reason I could think is that it shows our problem-solving skills and adaptability. I think interviewers may be more interested in candidates that are open to personal and professional growth and those who are actually taking actions to improve. I think by discussing our weakness and the steps we're taking to overcome it, we can demonstrate that we have the adaptability, we have the problem-solving skills, and we are committed to professional growth. And the third reason I can see is that it shows our integrity. I think providing an honest answer really demonstrates integrity and transparency. I think these qualities are very highly valued in the workplace because they contribute to trust, accountability, more effective communication, and less conflict. So these are the reasons I was thinking about why interviewers want to ask this question. And in the following session, I'd like to discuss my strategy to answer this question. And I took three steps. The first is, what is my weakness? Second, what have I done to improve? And the third is, what have I learned during this process? I'd like to share an example when I was applying for residency. And at that moment, I was very new to the pathology field, and I knew very few people in the field. So I thought that an area that I could really work on to improve is to making new connections in the field. So I raised an example of attending academic conferences where my main focus used to be only giving a solid presentation and chat with people who came up to me. But after my awareness of my weakness or the places I want to improve, I sort of take a more proactive approach to connect with others. For example, a few months before my residency application or the interview time, I attended my first pathology meeting. That is the ASCP annual meeting. And there I presented a poster. And to step it up, I started asking questions during the QA sessions after lectures. And I tried to introduce myself to the speakers afterward. I also made an effort to connect with residents and fellows by discussing their work and exchanging ideas. I think this approach was very helpful to me. I received very valuable guidance from faculty and trainees on things like applying for residencies and also interview skills. I also learned two very important things to me. The first is that getting ready to ask questions really helped me to pay closer attention to the lectures. Second is that I learned the pathology community is a very supportive field. The pathologists are more than willing to help me when I show my interest and the need. So I feel very good about the improvement I have made, but I knew that I still have room to improve in this area. So that was my sort of self-reflection to my places that I can improve at that moment. And I think this provides an answer of my introspection and my willing or dedication to professional growth. So in summary, I think when an interviewer asks us about our weakness, they're not just simply trying to expose our shortcomings. Instead, they are more interested in how we perceive and handle our weakness, because this can reveal very important traits that are relevant to our potential for success. I think providing an honest, thoughtful, and positive answer to this question will make a strong impression and help us stand out during the interview. I hope the discussion helps. I'll see you in the next video.